the representative of a lawyer or judges. Are you together? It is the same thing. You are able to judge good and bad. It's the same thing that brings about behavioral change. Do we have men here? Do we have men here? Do we have boys here? Then you have boys, you don't have men. Because the boys have responded, men are not here. The moment you look at a lady, are you together? And then you look at this fine, beautiful, amazing looking, sweet girl, you're able to attach emotions. I said, wow, this lady is beautiful. Are you together? Then, when you're angry, you are able to attach emotions within the frontal lobe. Yesterday. Pardon? Date. And day. Something in the unconscious mind. Then we also have speaking. You're able to hear me just because of the frontal lobe. So all those activities are controlled within the frontal lobe. Then look at where you carry things up on your head. Are you together? That one we call parietal lobe. Ignore the frontal lobe meanwhile. That one is important in knowing right from, which one is your left hand side? Lift your left hand side. On the right hand side, the people who are getting confused. When I tell them to lift the left, they're lifting the right. Chances are their parietal lobe is not working well. Are you together? Let's try one more time. Which one is your right hand side? And your right hand side? Oh yes, there you've made it right. Okay, sensation. Do you understand the word sensation? Then reading. Are you together? How many of you people are reading? I want to see somebody who is reading. Read for me what you've just written last. Sensation. She wrote sensation. She's able to do what? She's able to read. Are you together? So all that is controlled by the parietal lobe. Then you also have body orientation and sensory discrimination. Meaning any touch, you would feel it. And it will be interpreted as somebody has touched you. Are you together? So, the responsibility done by the parietal lobe. Then, we look at what we call the occipital lobe. Where do we find occipital lobe? The occipital lobe, the yellow one, you touch it where in your brain? Yeah, slightly behind. Are you together? So what does it do? Funny enough, it gives us what? Vision. So anything you're seeing is interpreted from where? From the back of your what? Of your brain. Visual reception and visual interpretation. Are you together? Anything you see, you're able to interpret it from where? From the back of your head. Then, let's look at the temporal lobe, the red one. At the side of your what? Of your head. What do? Understanding languages. If Ruth speaks to us in Nyankore right now, we are able to interpret because of the temporal lobe. Why do you think so? Well, leave alone the science. Me, I think that's the reason even why yes is placed there, right? Maybe yes. Okay? Then, if I speak in my Luo language, you're able to say, this man is speaking in Luo. That is because of the temporal lobe. Then we also have behavior. Your behavior, you're behaving the way you're behaving Because of the temporal lobe. You're able to interpret somebody's behavior because of the temporal lobe. Then memory, thank God it also has the memory part of it. Then hearing, thank you. We talked about it. And that's the reason I think why God has put the ears closer to what? To the temporal lobe. If they had put it far, maybe interpretation would be hard. Then you also have at the back, deep down, what you call the cerebellum. Now the cerebellum controls. Are you together? If they tell you stand up and stand on your one leg, you're able to stand on your one leg because of the cerebellum. You knock the stone and you're about to fall and you resist. You gain your balance because of the cerebellum. Those of you who like biking, you're able to balance on a bicycle because of the cerebellum. If you're climbing a tree, you're able to balance on a branch of a tree because of. You're climbing a stairs down, you're able to balance left, right, center because of. So, control comes from the cerebellum. Coordination. You're able to pick something from the left-hand side of your left-hand side and give it to the right-hand side because of the cerebellum. That is what you call. You're able to turn around and understand what's on the screen because of the coordination. So ladies and gentlemen, you also have what you call the fine muscle control. The fine muscles, these are muscles like the internal muscles, okay? All those are controlled by the cerebellum. Last but not least, you also have what's called the brain stem. Are you together? The brain has its stem also, not only the trees. So, how many of you, Ruth, what time do you sleep in the night? At 1 a.m., okay? But at 9, Ruth is here, right? Through her sleeping time, did you only sleep for 1.5 hours? Do you have that? If you don't have an alarm, there's no way out you're going to wake up. That's what you call consciousness. You cannot control consciousness. Then, breathing. How many times? Remind me your name. George. How many times have you been breathing ever since you woke up? Are we together? There are things we don't have control over. You breathe and don't even have an idea over how many times. In and out. Are you together? Even if you say, today I'm going to count, will you finish up? You're going to get interrupted and you cannot. Then, blood pressure. I wish somebody has control over blood pressure. We wouldn't be having a condition called high blood pressure or low blood pressure. Are we together? You have no control telling your heart, today, you're going to pump like 4 times only. And the rest of the time, you should relax. No, that doesn't happen. You don't have control over that. Then we have heartbeat. There's that boop, 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 beating of the sound. No one has control over that. And if you put your hand, you would feel that the heart is what? It's beating. But you have no control. Let me fast. Not to beat too much. It cannot happen that way. Then, sleep. I talked about that. Body temperature. All of a sudden, my body should become cold. Or it is cold like this. Please, my body, can you feel warm? No. It is the body that has that. And then digestion. All you need to do is go to the restaurant or eat food at home and eat your food safe. Are you together? You cannot tell my digestion or breakdown of food in my stomach is going to happen for only 30 seconds. No. Then, swallowing. Deep inside your heart, first swallow saliva right now. Got in the what? Inside? No. Are you together? Okay. Ruth is taking tea or water. Can she tell me that, you know what? My tea is going to stay here until we finish the training? Are we together? So there are things we have no control over. And all these are controlled by the stem. And you realize that the stem connects to this central nervous, the spinal cord. Are we together? And we break the science, we break it and break it and break it. Now, we've understood what the brain is. You see how complex it is? So many responsibilities attached to the brain. Let's go deeper and see. The brain is a very energy hungry. Are you together? The brain needs energy 24/7. At rest, it uses about night lights. Are you together? Do you see the energy a night light, a bulb uses? The energy the bulb uses is equivalent to about 20 watts. That's the same energy your brain does what? Need. But the energy demand rises rapidly when the brain is busy. You get the point? Just imagine right now we are in the training and you're forcing yourself to understand what you're training, even if you're not a scientist. In fact, you it's even more worse because you need a lot of concentration to understand that, okay, we've talked about the what? The stem. What are some of the functions of the stem? If I start asking one by one, you'll see how much what? Energy you need to answer. Are you together? So, you're also saying the brain needs oxygen to do this. Are you together? Then what happens? Blood delivers glucose and oxygen to the brain and also remove waste products. You see the coordination? So it circulates through the brain via a complex network of blood vessels. The farther and the deeper in the brain the network penetrates, the smaller the blood vessels become. Let's go further. If there is not enough oxygen, listen carefully. We said very well the brain needs oxygen, isn't it? But again, if this oxygen is not enough, and food getting into the brain, and rubbish is not getting out, or maybe toxins are not getting out, or maybe waste products are not getting out, then there is a damage likely to occur. Are we together? For as long as the supply of oxygen, for as long as you're not removing some of the toxins from the brain, then there are chances you're going to be a victim of what you're going to discuss ahead. Brain facts, listen to this carefully. 1 to 1.5 liters of blood. Do you know how many? 1.5 liters, that's too much. Are you together? Go through the brain every single what? You see, 1 minute like this, 1.5 liters has rotated in your brain. The human body has a total of about how many liters? 5 liters. So that means out of the total 5 liters, 1.5 liters has to go where? To the brain. And the other part of the body is sharing the 3.5. A very complex work for the brain. Let's go ahead. You see, that's how the brain is. If it is extracted and removed and placed on the table, that's how the brain looks like. But again, your brain consists of what? They're purely fats. Are you together? Just compare with the brain of a goat. Who has ever seen the brain of a goat? None of us. You people need to also go to the village, because some of us who stay in the village, we don't throw the head of a goat. Are we together? And the moment they put it on the plate, we have to dissect it and look for what? For the brain. Now, this is a problem of staying in the what? In town. You don't understand what the brain of a goat is. Then, 60% of the brain is fat, making it the fattest organ in the body. We're talking about fat. Do you realize that now fat is also very important? So 60% of this is complete. Fats. Let's look. Minerals for brain health. Omega 3 fatty acids, vitamins B, then K vitamins, okay, then antioxidants. Why that? Because that is more of the fatty acids, the good fat. Then we also have the vitamins. Then we also have the K vitamin. This is actually what controls blood movement. Okay. Then we also have antioxidants. Very important to remove the what? The toxins. Are you understanding? Yes. Do we connect from where we are coming from? Because we need to understand this, then we are able to understand what kind of product we should give. Either to increase the level of fat or to allow movement of blood. Okay? And I've given some example of what you can actually eat. Are we together? So ladies and gentlemen, going forward, brain, blood, supply. The blood flow, the movement of blood through vessels, supply, is basically surrounding the structures. So you realize that so many blood vessels surrounding what? The structure of your brain. Much as inside there are fats, then there are blood vessels around it to supply the 1.5 liters. Because if there are no blood vessels, then there will be no supply of blood to the brain. But again, we shall understand that does the blood need to straight away move through the vessels, or you can also go and add on blood there? No, you cannot add blood there. Because the moment it happens, then there's a problem. Let's go ahead and see. Now, we are relating all that to stroke. Ladies and gentlemen, stroke does not happen in the physical body where you see the person has got disability. Stroke starts from where? From the brain. And that is why it was so important for us to understand what is this brain about? What are some of the structure like? What are some of the functions of the brain? And thereafter, we shall now relate very well to stroke. Then we are saying a stroke happens when there is loss of what? Blood flow to part of the brain. Your brain cell cannot get oxygen, nutrients they need from the blood, and they start to die within a few minutes. For as long as there is insufficient supply of blood, or if at all, it's supposed to be 1.5 liters. And then for some reason, the supply is about 1 liter. Then there's going to be a problem. And the same, these can cause brain damage, long-term disability, or even death. It can be partial disability, or it can be complete death. Then, this is what happens. The stroke has its own types. Okay? There are two major types. Number one is what we call ischemic stroke. This is caused by blood clot. Listen carefully. You remember now the blood vessels that we talk about that's surrounding the what? The brain. If at all there are toxins, if at all there are remnants, or if at all there are things that is not needed in the brain, and for as long as it goes through the veins, it can clog, or it can block the what? The vessels. And for as long as the vessels is clogged, we call that ischemic stroke. That blocks all plaques or blood vessels in the brain. And it is the most common type. About 80% of stroke are ischemic. Meaning, you live in your life. Maybe there was a blood clot. Blood was flowing normally. But then somehow it blocks the movement. Okay, that's going to the brain. You remember the frontal lobe? You remember the temporal lobe? You remember the stem? Each of those have blood vessels supplying them with blood. Now, for as long as anything happens, let me take you back briefly. Here, for as long as anything cuts off supply of blood to the stem, all these things are distorted. You see somebody passing urine on themselves. Are you together? You see somebody, their breathing is now questionable. You see somebody high blood pressure has what? Has gone high. You see somebody heartbeat is too fast. If at all the blockage or that clot happens to the cerebellum, there's going to be lack of what? Balance. Why do people fall in the what? In the bathroom? You think it's a bathroom disease? No. Because all of a sudden, that has happened. You realize the coordination. Somebody, their hand is completely, it's no longer working. They cannot lift up and down. Because the blood supply to this what? To this area has been cut off. Ladies and gentlemen, look at the temporal lobe. Are you together? Then behavior change. You do not know that you are supposed to go to the toilet. Are you together? Your memory, you cannot remember what has happened. Consciousness has been distorted. Why? Because there has been complete cut off blood supply to that particular area. Same thing applies to the frontal, to the parietal, and other parts of the brain. That's why when somebody has stroke, somebody is paralyzed one side, and the mouth is what? Twisted. Somebody is paralyzed one side, and the eyes no longer seeing. Somebody is paralyzed one side, they have difficulty in speaking. Are we together? And all those come because there has been complete cut of blood. Oh, there's just something blocking. I don't know whether Madam Jara is here. There was one time I saw her video where she was trying to train us about prostate enlargement. Okay? So she has put a straw and put water. Water was flowing and she had to squeeze it like this. There was no water passing. Right? So imagine the same thing happens, that something blocks your vein. You'll end up with stroke. Let's go ahead and see. So that was ischemic stroke, maybe because of any blockage. Now there's what you call hemorrhagic stroke. For as long as you have your functional brain, there should never be any blood outside vein. Blood should only be supplied through the vein or the vessels. Now what happens? If there is any rupture or if there's any tear, are we together? This is called by blood vessels break and bleed into the... Why do people get stroke when they get accident or brain injuries or head injuries? They say in Luganda is that the what blood has done what? Musayakozechi? Thank you. Are you together? So for blood should never go in the brain. Much as there should be sufficient blood of supply through the vessels. If it happens, then it can cause stroke. Also, we are saying there's what we call, the last is transient ischemic attack. It's actually sometimes called mini stroke. Okay, it's not a major type, but also it's one of the type of stroke. And this is what happens. This is exactly what we're trying to explain. Ischemic stroke has poor supply of blood. And then that means if there's no supply of blood, then there's what you call cyanosis. You start realizing that you're becoming a bit of bluish, purplish in color. That means oxygen supply has been cut off. Are you together? If you see somebody with lack of oxygen in the body, you see the extremities now turning more of purple in color or bluish. We also have hemorrhagic, the one I've just talked about, that there should not be any mistake to leave the vessels. If any mistake happens, you have a head injury and blood leaves the original blood vessels, then there are higher chances of what? Of developing stroke. Ladies and gentlemen, going forward, Facts about stroke. The things you really need to know. These are studied facts. Are you together? We are saying brain is anything you need to think about a stroke. You're seeing limping and whatsoever reason, and you see the hand is helpless. First thing in your brain, think that there was attack to what? To the brain. Although stroke is more common after the age of 55, listen carefully. Don't say it is only for people who are above 50 years. They say, although it is more common in the age of 55, it can happen at any age, at any time, even right here. Are you together? So, be much vigilant and aware about your environment. And it can happen anytime. It can be the ischemic, it can be the hemorrhagic. Anywhere, anytime. And it is the leading cause of adult what? Disability. There's so many adults, when you see them, they're struggling. And they're disabled because of this. There are people I met in life, all of a sudden I got so scared about what life has to offer. Few days you've been seeing this person very okay. The next month you're seeing this person, the person is limping, and you ask yourself, what happened? The person has been attacked by stroke. In fact, not the person. The person's brain has been attacked. Are you together? Then, every 40 seconds, this is studies that has been done. Someone is what? Is being attacked by stroke. Every 40 seconds. Ladies and gentlemen, listen carefully. Every 40 seconds. That means the time you've spent here training, there's so many people have now what? Got a stroke. And you have no formula how it can come about. Then 2 million brain cells. The moment the brain is attacked, then 2 million cells die every single minute. Every 30 seconds, 2 million cells die what? Out of that attack. So that should be one thing that should never be ignored. Or even the symptoms. We are going to see ahead. What are some of the symptoms of stroke? What would you say that maybe this person is what? Is developing stroke. I don't know how many minutes you should help this person within the first 180 seconds. Are we together? So even if you're in the hospital, even if you're in the village, so within 3 minutes you should rush this person to the what? The nearest health facility. For you maybe to actually regain this person's ability. So, that's fact about what? About stroke. Ladies and gentlemen, we talked about that already. Who are some of the people at risk? You think it's about 55 years? Maybe not. Let's break it down. Do you know, have you ever heard about somebody with diabetes? You've ever, right? This person is at a very high risk. Then, heart disease. And other heart disease can also cause blood clot, and that leads to stroke. Are we together? Anybody with hypertension, anybody with a heart-related condition, not necessarily hypertension, the valves cannot be working well, maybe. And you hear they're telling you somebody's going to go to India for heart what? Open heart surgery. Then, smoking. Smoking, what smoking does? Smoking constricts, okay, or it narrows the what? The blood vessels. You get the point? Then the moment it narrows the blood vessels, then it increases the chances of somebody what? getting stroke. Why? Because there will be insufficient supply of blood to what? To the brain. Then if you have history of stroke, or if you have history of hypertension in your family, there are higher chances that at any one point your generation can be a victim. Age. The older you get, the higher the risk is. The moment you've clocked your 30s, 35, 40s, every time you wake up in the morning and you're okay, you've not gotten an attack of stroke, thank God and do something about it. Because the more you advance in your age, the higher the risk of stroke. Then, maybe the race, the Africans, they said we are the what? We are the higher risk. Yeah. Then, alcohol and illegal drug use. Physical inactivity. I wish OQATA grows bigger, that we shall also have our own gym. Are we together? Because it is so hard for some people to go even do what? 30 seconds of physical activity. Even if they say, please, can you do a bit of frog jump in your own bedroom? That's as if they are giving them punishment. You see, very young people, the moment they're starting up, they're going to be resting through the what? The stairs like 5 times before they can reach up there. Physical inactivity. Then you also have high cholesterol. Then unhealthy diets. This is where we all belong. Are you together? We think chicken and chips is the best food. We think Chikomando is the best food. Rolex. And some people say the street Rolex is actually the best. And we think those are the best food. Then obesity. Control your weight. Gone are the days when I was growing up and we used to think the fat people are the what? The rich people. Are we together? But it is now the reverse. So control your weight. Some of the habits that you know very well that you can prevent, but you're intentionally ignoring them. Your weight, I just talked about that. Inactivity, I talked about that. Smoking, I talked about that. Eating right, about diet. Monitor related conditions. I talked about hypertension, diabetes, other related conditions. Talk about liver related conditions. You know why? Because liver is the only thing that decides our blood. Okay? So if you have a liver related condition, the liver is going to pour the dirt in your the bloodstream. What is going to happen? It's still going straight through the brain. Manage your medications. Lower blood pressure, limit drinking. There are things you can actually stop. Or there are things we can teach people to stop or even minimize. Smoking, drinking. And there's so many people who are victims of that. Symptoms. If you're sleeping, wake up. Your father, your mother, your relatives, or anybody could be experiencing this. Are we together? Sudden what? Numbness. All of a sudden, I cannot feel my what? My hand. You cannot feel your hand. It is with you. What's wrong with you? Are you together? Why? Because stroke is setting on. Weakness of face, arm or leg. Are you together? So first come and massage my hands. I can't feel my hands. First come and massage my hands. Watch out for such symptoms. And most importantly, at the side of what? Of your body. Sudden confusion. It might not necessarily be mental illness. Are we together? It might be a symptom that somebody is about to develop or is getting stroke. They fail to understand your language. You're speaking the usual language, they're understanding their own different language. Confusion has set in. You're speaking in English, somebody's responding in what? In Swahili. I'm like, okay, we are not in Kenya, we are not in Tanzania. What's wrong with you? Are we together? So, confusion sets in. Sudden trouble seeing in one or both eyes. Are we together? Somebody says, wait, where are you? And they're trying to touch and look for you. The eyes has become blurred. They're no longer seeing very well. It is blurry. Then, difficulty walking, there's dizziness, there's loss of balance and coordination. And watch out for these signs, especially for people with hypertension. And watch out for these signs when somebody constantly talk about them. Do you realize that you can also get stroke even if you don't have hypertension? So true. So watch out for these signs. Go and train, teach people about these signs. Let people know that yes, you're much aware about these signs. Let them know you have all the idea and knowledge that they should keep watch of. Sudden severe headache with no known cause. So many guys struggle. So many people complain. And they'll tell you, maybe it has been hot lately. And they tell you, go and drink a lot of water. And over time, you ignore these symptoms. And one morning, somebody wakes up, goes to the bathroom, and before you know it, down. As far as not considering that there should be 180 seconds, then before you wait, somebody's not feeling their mouth. Somebody is speaking, the mouth is turning this side, and you're bringing your idea, you want to twist it the other side. This is science and nature. You can't control it. You yourself, if your mouth is twisting the other side, what would you do? You want it to go this side, isn't it? You turn it the opposite side. But no, it's already damage done to the brain. Are we together? That, all those are the symptoms of stroke. What's the heading there? Are we together? This is how you're going to identify. Are you together? And even they've made it more easier. Be what? Be fast. Within the 180 seconds, we're talking about be very fast. So what happens? The fast test can help you remember what to look for. If you think someone is having stroke, think what? Think fast. Okay? So we are saying, face drop on one side or smiling. I mean, when smiling. You realize I'm smiling, but the face is turning left, right, and I'm like, what's happening to this person? The eye is opening, the mouth is closing, and you ask yourself, what's going on? Arm weaknesses occur when the arms are raised and one arm drifts downward. Tell the person is raising their hands, and all of a sudden there's no energy, the hands falls back. Then, speech is slurred or strange. The person is speaking as though a young child learning how to speak. Someone is speaking, understanding what you're telling them, but they're unable to respond to you. I've ever met one of my friend's mother, may her soul rest in peace. She actually died later. We went to visit this lady. She was already attacked by stroke. And this lady reaching there, she was so happy and excited. That excitement you feel that at least should talk to somebody. You talk and talk and talk and talk. The moment it's that time to respond, all you can see is the tears flowing because I can't say a word. Speech is definitely triggered. And it's time to do what? It is the right time to call 911. Rush. You might not dial 911, but again, you are the 911 yourself. Saying, be fast. You've talked about the fast. Then they've added, be fast. Look at the balance. Check on the eyes as well. Are we together? So the moment you monitor those, and you're able to actually immediately make a decision that this person has stroke, rush them to the hospital. Rush to the hospital. Ladies and gentlemen, stroke, the best time to prevent stroke is, let's read this order. The best time to prevent stroke is, are we together? Before you get the stroke, the only time you can do what? You can prevent stroke. So in other words, we are on the right track. Who agrees with me? We are on the right track. I'm going to tell you why. Okay? Okay. Stroke prevention. Keep your blood pressure low. Cholesterol low. Eating habits should be monitored. Exercise regularly. Treat sleep apnea. Manage your diabetes. Drink in moderate. Stop smoking. Avoid stress. Maintain healthy weight. How? I'll tell you how. Ladies and gentlemen, cerebral small vessel disease. Are you together? Now, the blood vessels, like I said earlier, they get ruptured. This blood vessel can get ruptured because of too much blood pressure. The releasing a lot of fluid in a very small narrow pipe, what happens? It breaks, isn't it? It breaks off. Even if it is this natural water. Are you together? The moment there's too much pressure, maybe somewhere you see there's a leakage. And the moment there's a leakage, it brings us what we call cerebral small vessels disease. Okay? I'm not going to go through this. Discuss that earlier. Stop stroke. Let's fight it off. Let's avoid it. Ladies and gentlemen, can we give a big round of applause? We are on a journey to do what? To stop stroke, right? The solution brings us a perfect solution to our problem. That is, genuinely, how many are taking super omega 3? We talked about prevention. Right together. I only see 2 people. Right together. How many people are less than a month old in the business? Yes. Are you understanding? This is the point. You should be the product of the product. Are you together? You should start using super omega 3 yourself. So, what is super omega 3? These are what we call polyunsaturated fats. Okay? But, and yet your body does what? Eats it. The polyunsaturated fat is actually a chemical structure where poly means many. Unsaturated refers to the bond. It's a chemical structure. Forget about the chemistry here. These fats are a crucial part of the cell. You know how the cell is, the structure of the cell. We've drawn it somewhere here, so many times. Okay? And it has got what we call the membrane. And it serves many important functions, such as improving heart health, eye health, brain health, infant health. How many mothers are here? The moment you plan to get pregnant again, omega 3 for you. Are you together? If you're breastfeeding, super omega-3 for you. If you're engaged lately, super omega-3 for you. If you're fully married, if you're newly married, super omega-3 for you. So that, yes. Are you? I will offer you one if in any case you are. Why? Because your child who will be unable to swallow, your child who is a fetus in your womb will need this super omega-3. Then the also decreasing liver-related conditions. Guys, liver is another topic of for another day. But have you had so many people struggling with what we call non-alcoholic? They don't drink, but the liver is being attacked by what? By fat. So, it's one of them. Those fats around your liver. And if you start talking about the liver, now it's another complex, very long topic. Until when you get liver cancer, if you ignore it anyways. Dietary supplement in a soft gel loaded with fatty acid, loaded with vitamin E, loaded with what called alpha linoleic acid. Fish oil is derived from the tissue of oil. Fish is what you call it in super omega. Well and good. If you choose and landed on super omega-3 somewhere else, focus on what you call the EPA and the DHA. And that is the ingredient. Look, how many of you, even if you're taking it, ever bother to understand what is the ingredient and how much EPA? The quantity is what matters in the body. It is, maybe where it comes from matters most, but then how much you take matters the most. Okay? So there's what you call the ALA, okay? Alpha linoleic acid. This one is not derived from fish. Okay? This one is derived from plants like flaxseed oil or vitamin E. They are now essential in reducing what they so-called bad cholesterol. But there's no bad cholesterol. Cholesterol is cholesterol. Okay? I'm going to explain to you further. This is what happens. The EPA and the DHA, this is now the most important part that we need. Okay? The DHA, what does it focus on? The brain health and also on the eye health. And then the EPA, you focus on the joint, focus on the total health, focus on the heart rate or the heart health. Okay, types of, ladies and gentlemen, we used to know that there's what called bad cholesterol, but I want to make it clear. Cholesterol is cholesterol, okay? LDL, what you call the low density lipoprotein, or the density lipoprotein. Then there's what you call the high density lipoprotein. These are not bad cholesterol, but bad fats. These are what you call carriers of what? Of cholesterol. Okay? The good one, or what we call the good one, which is the high density lipoprotein, carries this cholesterol to the what? From the body to the heart. Then this one carries cholesterol away from the cells. So, all in all, they are necessary. Are we together? But how much do you have is what makes the difference. Are we understanding? Beautiful. So, ladies and gentlemen, that's what happened. Cardiovascular support. But rather, you also help in the brain. Because this, okay? And also blood vessels. But again, inside is a hollow. Are we together? It's a hole where blood is supposed to do what? To pass. But because of our lifestyle, this accumulation of what? Those yellow things you're seeing, those accumulation of fats. And then thereafter, it blocks the movement of blood. So how then does super omega-3 help the heart? It reduces platelets aggregation or stickiness. Are you together? Those of you who come from the village, including me, when we were still growing up, we used to play along the streams, water streams, okay? So there are things that are, that always flows through the water. The moment they find anything like a stick, they will what? They'll stop there, isn't it? Another will come, we'll find another one, they stop there. Then you find them accumulating and clogging the water. And makes it easy because it was sticky to each other. Same thing, we are saying we are reducing the platelets from being so sticky that they can easily attach to the blood vessels. Then clots and improve blood flow and oxygen supply to it. That's the importance of you taking super omega-3. I mean, it is for yourself. Why? Because it will improve the blood flow. And if it improves the blood flow, definitely oxygen is going to move. Improves overall cardiovascular health. Do you know that if you put your hand on your chest, right, and you hear there's that boom, boom sound, right? There are always two sounds. There's boom, 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 like that. That sound comes, the hard one is blood leaving your what? Your heart and going to all the parts of the body. And then there's this, the soft one. Okay? This one now, the heart is receiving blood from other parts of the body. Somebody is doing the practical. I'm going to invite you out in front here and come on and test for us. Okay? So there's that poop poop sound. Out, in, out, in, out, in. And this has happened for the number of years you've lived. Are we together? So we are saying it improves overall cardiovascular health. The heart has what we call the valves. That by the time it pumps blood, that means it should not allow blood pass inside. The moment it has pumped out, it is going to lock and open this other one that allows blood in. This is for another what? Another time. We shall train the next time. It improves heart health and reduces the risk of coronary heart disease. And it also helps regulate cholesterol in the body by reducing what calls the bad cholesterol. The low density lipoprotein. We don't need it in high quantity. Also reduces the risk of heart disease and stroke. See? And also cardiac arrhythmias or heart attacks. Prevents atherosclerosis. This is a plugs. Formation of fats. Okay? Formation of fat inside the blood vessels. Also, hardening of the arteries. Ladies and gentlemen, the DHA, in brief, and its main benefits, it is these are fish that are found in cold water, including tuna and salmon. Salmon fish, they're not found in Lake Victoria. No. That's why you don't see any super omega-3 coming from Uganda. Maybe if they were here. Are you together? Support brain development and function, support and essential for fetal and also the development of the fetus, especially their eyes and brain. Why don't you recommend super omega-3 for pregnant mothers? Because definitely their children is going to benefit from this. And the mother will do anything possible for their children. And also support fetal cognitive and motor skills development. Cognitive is anything to do with the brain. Motor is when you give birth to a child and your child is unable to even move their body. You need to give birth to a child who is very active and they're moving their body, the legs and the arms. So before you can give birth to a child who is so dormant and not moving, the right time is now. Are you together? Yes. And this actually mostly goes to the pregnant mothers. Pregnant mothers around here, please take note. Reduce the symptom of depression, anxiety, and bipolar. Bipolar is a mental related disease. Okay? Then support neuroplasticity and also neurotransmitters. Neurons. I've had people in the corridors talking about nerves, sciatica, neuropathy. See someone in front of the camera talking about what? Neuropathy. Coordinations of nerve. You see them really talking very good about it. You know very well that the moment you don't support the nerve, the senses will completely die. Are you together? So, also the ALA, alpha-linoleic acid, has about 200 milligrams. Now, what happens? The functions, this we said earlier, it is found in plant-based food. Okay, flaxseed oil, soybean oil, and all. But what happens here? It's a compound produced by the body that is strongly antioxidant and anti-inflammatory. To the EPA and DHA, they are not active EPA, active DHA. But the moment you consume them, then the body converts them into. Are you together? So, conversion happens to EPA and the DHA, and that supports the heart. But also, it is an antioxidant. You said you should detoxify the brain, right? To avoid stroke. So it is the same thing that's going to. It is useful in buffering the damage from the heavy metals and clearing them from the body, and also aid with other poisons such as those from bacteria. Does that make sense? You could be having a bacterial infection. The poison released by those bacteria. So the only option is for you to have such kind of what? Antioxidant, get them out from your body. Ladies and gentlemen, typical antioxidant. But also very good for your skin. Are you together? I think very shiny. I think most people are now using too much of hair, skin, and nails, and also super omega-3. Because the face is shining from this side too much. Nobody's having even a trace of pimples, and you wonder what they're using. Maybe they're using product, isn't it? But again, we are saying it's a fat-soluble vitamin essential for various bodily functions, antioxidant. We talked about oxidative stress. This is exactly what I was talking about. Your body is very okay. It's normal. But because of lifestyle, whatever happens, we introduce what's called free radicals through different sources. But the moment free radicals enter our body, all they are fighting for is to pick one molecule from our cells. You see, our body is balanced. Then they want, this is having one single molecule. This is now an antioxidant, the vitamin A's we are talking about. The moment this enters, it will start fighting off your cells. And it will grab one of your molecule. The moment it grabs one, it becomes happy. And also going to another one, another cell, another cell, another cell. But what do we need to do? We need to neutralize it by introducing that vitamin E. Vitamin E will say, please, please, please calm down. You're too angry. Get one of my molecule. Okay? So that you also balance yourself. And to avoid your cells from dying out. Together. So, vitamin E supports cardiovascular health, helps also prevent oxidation, and especially the LDL cholesterol, which is a risk factor for heart diseases. It supports immunity, it helps regulate immune responses, it enhances the. Let's pause here a little bit. It helps support immune responses. How many of you people have allergies? Or somebody asks you, I've been having allergies, how can I manage allergies? Get the point? I've been having sinuses. Somebody texted me. I wish that person is in this house. Maybe not. I wish the person is online, actually. They said, I have been having sinuses for so long. I've been having allergies, skin allergies for so long. How do I manage it? Allergies are autoimmune body responses. The body is just responding to a factor. Could be dust, could be pollen, could be heat, could be cold, could be anything. Food. And then the body starts what? Saying, what you're putting is not right. If you have allergy, you start sneezing. The nose starts itching. The skin starts itching. Then, what they hear saying, it helps regulate immune responses. If you say, no, calm down. Yes, dust is bad, but right now it's not damaging your body. Yes, heat is there, but it's not what? It's not dangerous. They are responding, they are rejecting. Okay? So that's why we need such kind of vitamins. It's also very good anti-inflammatory, but also it relieves symptoms of osteoarthritis. Also rheumatoid arthritis and in other many inflammatory diseases. For example, I've talked about those allergies. Allergies are also inflammatory conditions. Okay? So ladies and gentlemen, omega-3 health benefits. The brain is full of what? We talked about that. So it supports brain health and cognitive function, improves memory, focus, and concentration, reduces symptoms of anxiety. We talked about the bipolar. Also supports neuroplasticity and neurotransmitters. We talked about that. Reduces risk of neurodegenerative diseases. Are you together? So you realize that you have all that reason. Besides just taking it for stroke, you have so many more reasons as to why you should take that. Okay? So ladies and gentlemen, omega-3 for eyes protect vision and eye health, reduces the risk of age-related macular degeneration, also improves eye health in individuals with diabetes. Prevents and delays formation of eye diseases like dryness. Also, eye syndrome, age-related macular degenerative diseases. Okay, so omega-3 vitamin A and inflammation. You see, it has all its reasons to different conditions. It reduces inflammation in joints, muscles, and tissues. It relieves pain and also swelling. Improves symptom of arthritis. We talked about that. And also, it supports immune system functions. Who can benefit? Anybody age about 10 to 70 years old or above, gender both male and female, individuals with high cholesterol. Pause there. Are you together? How many of you have taken their cholesterol level? How many of you? Do you first want to go high and then you start to omega-3? You don't have to wait for that time. Okay? So ladies and gentlemen, those at risk of heart diseases, people with high blood pressure, people with family history of cardiovascular diseases, individuals with diabetes, metabolic syndrome, health and to be healthy. You don't have to wait for diseases for you to start on these things. What's the sixth point? Pregnant mothers, ladies, watch out. Tell your friends to tell their friends to tell their friends. Specific health interests, cholesterol management, heart-related condition, prevention of high blood pressure, management of overall wellness. Okay? So, psychographic, health-oriented, cardiovascular diseases, we talked about all these. See now, the heart has so many different diseases. Okay? All these are diseases of the heart. It might not necessarily be the high blood pressure. All you see, heart diseases, what you call high cholesterol, coronary artery disease, peripheral artery disease, stroke, high blood pressure, all those affect the heart. Okay? So ladies and gentlemen, neurological disorders, depression, anxiety, bipolar disorders, attention deficit, hyperactivity disorder, children, this can affect the children. Okay? You also have inflammatory conditions. Okay? The recommended doses, adults, take about 2 to 3. Okay? But if you manage, if you are taking just because of your health related, just to be healthy, you can do even if you want single capsule. It is very helpful. It's very unfortunate that we did not think of doing a practical here. We are going to do a practical here, and you see how powerful super omega-3 is. Pardon? You want to see? Who has super omega-3? Open. You have a sealed one. Okay, we can also get some other time, and you do the practical. It's very, very powerful. Very, very, very powerful. Those who are interested, maybe after the training, you can also sit in the other training room. We can do a practical and really see that what you're missing is something genuine. Are you together? Because we shall need hot water. Maybe we can even get hot water from there. But do you know, have you ever taken fruits? You see those breakable plates that they use to serve fruits? You get the point? This is what you're going to do. Maybe in our small groups, we can do that practical, right? Get hot water, okay? Put in one glass. Then get cold water, put in another glass. Or even hot water, actually. Put hot water in both glasses. Then you break that plate and put in both what? In both cups. Okay? How do they call it? They're disposable. They're those disposable, but not these hard disposable ones. The one that breaks. So what happens? You get at least 2 capsules of what? Super omega-3. Pour in one glass with hot water and that disposable. This other one, leave it. No more. Give yourself just about 5 minutes and you see the miracle. You'll come and testify for us yourself. Are we together? And such a powerful product. We have amazing product, but this one product. Don't recommend one single product. Don't recommend 2. Never forget super omega-3. In every single recommendation, never recommend super omega-3. Yesterday, Madam Ruth came to me. I think she was recommending some product to somebody. And she was like, between this and omega-3, even before she finished up omega-3, I closed my ear and said, omega-3. Are we together? Why? Because I know how important it is. If time allows, we can also create some time and do that practical together and you see. Okay? Ladies and gentlemen, thank you so much. It was such an amazing time with you. I will come to the end of our trainings today. Okay? Can we give a big round of applause to ourselves? Most times when I train, Joey can get off live now. Okay, so most times when we train, we give time